So osteoarthritis, important things. Remember, there's only 4 types of osteoarthritis they're going to go after. Number 1 is going to be hand osteoarthritis. Number 2 is going to be hip, knee and back. Those are the 4. Hand, hip, knee and back. When it comes to hand osteoarthritis, the classic joint of involvement is going to be PIP and DIP. Okay, and you can have, we call this with some names. What are the names? For proximal you call it Bouchard's, and distal is going to be Herbert's nodules. That's it. So classically you'll have more distal effect. It's a wear and tear process that actually happens with osteoarthritis. Most of the time always going to affect big joints, right? Because too much pressure. So hip joints and knee joints. It's not very normal that you would see here, but older people you'll see these joints getting affected as well. So that's something for you to look at. And hip and knee, normally you're going to have classic involvement in them. Most of the time when it comes to diagnosis, for hand osteoarthritis, it's a clinical diagnosis. You do not need imaging. But when it comes to hip, and if it comes to knee and your spine, you're going to need x-ray to actually diagnose this. Okay. Now, they're not going to go into most things. They're going to go into treatment. Okay. So when it comes to your spine, what is the condition we speak about with osteoarthritis? It's called. Okay. So the way to remember: topical NSAIDs, oral NSAIDs, SNRIs, duloxetine. But before you do any of these, first step is exercise with Tai Chi. They love Tai Chi for osteoarthritis. Okay, so that's how you're gonna do. So hand, follow that step. If it's hip and knee, you cannot obviously rub. So you don't start with topical. You go directly to oral NSAIDs followed by duloxetine. Now sometimes some patients, if you cannot use NSAIDs for whatever reason, what are the contraindications for NSAIDs? If the patient's osteoarthritis is so bad in the knee, do you repair or replace? Never repair, always replace. Okay, when it comes to fibromyalgia, multiple point tenderness is going to be present. They're really only going to go after treatment. You're going to have exercise regimen first, followed by, when it comes to drugs, you have 2 drug groups. One is pregabalin and gabapentin, or you're going to use SNRIs, again, duloxetine. How do you decide which one you're going to use? If the patient has depression along with it, go with the SNRI, duloxetine. The patient does not have depression, go with pregabalin. Okay? Or if they say the patient has depression but already on an SSRI, right, then you don't want to use duloxetine because increased risk of serotonin syndrome. Then don't pick it. But really, just remember pregabalin and duloxetine. And milnacipran as well. Yes. Adult onset Still's disease, also known as juvenile rheumatoid arthritis. Another condition we need to know about. At least I think about this in a lot of patients who we get. Classic patient would be a patient who's having evening fevers. Okay, every evening they're going to have a fever. Apart from that, they're going to have a salmon rash. They're going to have arthralgias. Okay, so when you have a patient who's coming with fevers of unknown origin every day, and then you got a salmon rash, and they've got joint pains everywhere, you need to start thinking about adult onset Still's disease, also known as juvenile rheumatoid arthritis. What is your key kicker here to give you the diagnosis? Ferritin. You get your ferritin, and your ferritin. You all know how much I love my ferritin, right? You get a ferritin, and your ferritin will be greater than thousands. Whenever you have in the thousands, there should be 3 diagnoses that always comes to your head. What are the 3 diagnoses? Hemochromatosis, HLH, and juvenile rheumatoid arthritis. Okay. When it comes to hemochromatosis, what is the test you screen them by? Ferritin is first. You get ferritin. If you're suspecting hemochromatosis, get a ferritin, and the ferritin is going to be high. But is that a good test? No, because it's an acute phase reactant. It can be high for whatever reason, right? Yeah. So what is a better test for hemochromatosis?
Saturation.
Percentage saturation. What should your number be greater than? Now, remember osteoarthritis, I said, it typically happens in older people. If you ever get osteoarthritis in a young person, below the age of 50, in weird joints that are not supposed to get affected, such as your wrists, and your metacarpophalangeal joint and your shoulders, what should you always think about? Okay, I think that's it. Thank you for watching. If you like our content, please like this video, subscribe to our channel, and hit the bell icon so you get notified when a video is released every week. Have fun studying. We'll see you on the next one.